Botox didn't fail you. It was just asked to do a job it was never meant to do. I'm a facial plastic surgeon, and I frequently hear patients who say they are frustrated with Botox, not because it doesn't work, but because it was expected to do something it wasn't meant to do. When Botox is misunderstood, people end up with frozen expressions, unnatural results, or disappointment that could have been avoided. By the end of this video, you'll understand what Botox actually does, what it does not do, and how to think about facial aging so you make smarter, more natural decisions for your face. Botox has one very specific job. It relaxes muscles. That's it. It doesn't add volume. It does not lift skin. It doesn't replace structure. Think of Botox like taking your foot off the gas. If a muscle is constantly pulling, Botox tells it to relax so the skin on top isn't being folded over and over again. That's why it works so well for expression lines, like the lines between your eyebrows or across your forehead. When people get confused is when they start using Botox to chase problems it wasn't designed to solve. One example is some social media injectors going online to promote the idea that Botox injected into the depressor angular oris region can help lift your sagging face or jaws. One injector pointed to injection site and explained how that muscle, if relaxed, will allow the rest of your facial muscles to lift the jaw. This is false. Your jawling is due to various factors, primarily sagging fat, loose skin caused by loss of collagen and elasticity, volume loss, and bone resorption. Everything just goes downhill. It's not due to strong platysmal allosos or DAOs pulling your face down. Putting Botox into the platysma or DAOs won't lift your sagging face. As we age, the face doesn't just wrinkle. We lose volume, fats patch shrink, skin thins, gravity starts to win. Botox can't replace what's missing. So when people keep adding more Botox to fix sagging or hollowing, the face doesn't look younger, it just looks stiff. That's how you end up with a smooth forehead that still looks tired, or a face that doesn't move naturally anymore. Botox is a tool, a very good one, but it's only one tool. One question I hear from time to time is, why does my Botox wear off faster now? First of all, it could just be the patient is seeing more noticeable sagging tissue and mistakenly thinks that must mean the Botox is wearing off quicker, when in reality, the underlying aging process has progressed, and Botox is being asked to compensate for volume loss or skin laxity. Now, rarely I have seen patients who truly experience shorter duration of Botox. The specific dynamic muscle is returning to full strength quicker than usual. Botox generally lasts 3 months, but you may start to see some early return of motion around 2.5 months. So when someone sees returning motion in weeks or less than 2 months, that is unusual. The most common cause is the patient has developed antibodies that now make the patient more resistant to that particular botulinum toxin product. The most frequent cause of this is if the patient gets re-injected with Botox too soon. Even if you notice early returning motion less than 3 months, if you get another injection before 3 months, that does increase the risk you will develop a resistance to that neuromodulator. If that happens, it's hard to continue getting the same effect. Often your only recourse is to switch to another neuromodulator. For example, if you start to show resistance to Botox, then you may need to switch to Dysport or Daxxify. Another common question is, can I just do more Botox instead? More Botox doesn't mean better results. Past a certain point, it just limits movement without improving appearance. And sometimes patients ask, what happens if I don't do anything? The face continues to age naturally. Botox can help slow certain lines, but it doesn't stop time, and it shouldn't be used as a standalone solution forever. The biggest fear people have is looking unnatural, and that fear is valid. But unnatural results don't come from Botox itself. They come from misunderstanding its role. When Botox is used strategically in the right areas, balanced with other approaches when needed, the goal isn't to erase your face. It's to soften tension, to let your features rest, and to keep you looking like yourself, just less tired. The key isn't doing more. It's doing what actually matches what's happening beneath the skin. Good aesthetic care isn't about chasing every line. It's about understanding why changes are happening and choosing the right tool for the right reason. Botox works best when it's part of a bigger picture, not a fix-all, not a shortcut, and not something you have to keep escalating. If this helped clarify how Botox really works, that kind of understanding is exactly what I want patients to have before making informed decisions about their face. If you like this video, make sure to like it and subscribe to the channel. Thank you for watching.